And then they already start off without being in debt. I mean, but one of the problems, as I understand, is we have a shortage of primary physicians in this country. Everybody goes into the specialties because they can make more money. But if you had more primary care physicians, you could, in a lot of cases, catch medical problems before they got to the point where it was a full-blown, costly kind of thing. You know, so that's an issue. So the government would have to have a way of encouraging doctors to take, you know, go into lines of medicine that like favor proactive solutions. And like I said, one way to do that would be just to pay their way. Now, it's, you know, you're asking about, you know, limiting how much money they can earn after the fact. I'm kind of in favor of the free medical school. You know, try it with the carrot first. You know, you try to take the positive, you know, route of giving someone something. You know, because I think, you know.
But if that didn't work.
If that didn't work, you'd have to get together and discuss it again and try to come to a solution. I mean, obviously, you know, I don't think I or anybody else here on either side of the issue, or President Obama himself, really has, you know, a solution for every possible problem, you know, mapped out in advance. I don't think that's not a possibility with human beings. We don't foresee the future. But you know, just get everybody together, all the involved parties, and then discuss it when it comes time to discuss that with an emphasis on trying to solve future problems. You know.
So, if you had to put your finger on one single issue that was the primary cause of the healthcare problem that we face today, what would that be?
Well, it probably has something to do with I mean, other countries, they have the public health care. But I think that other countries also have a greater sense of collective responsibility towards each other than we do in this country. We've kind of grown up with that myth of the frontier, the rugged individual. You know, every man for himself. That's really deep-rooted in our national psyche. Getting Americans to work together collectively to solve problems, unless there's like some sort of clear and present danger, like Pearl Harbor or something, it's really, it's a tough one. And that's what I see as being a big problem in dealing with a lot of things that we face as a nation. You know, is that tendency to be like, well, you know, I'm all right, Jack. You know, you step back kind of mentality. But as far as the health insurance goes, it's the insurance companies. I mean, they're profit-driven enterprises, and you know, in a sense, it's kind of pointless to bash a profit-making company for wanting to make a profit. The question is, you know, do you allow that to be the dominating model for providing health care? I mean, there's nothing wrong with having profit-making companies make VCRs or DVDs or shoes or what have you. Those are like, you know, people can live without DVDs. They can live without DVD players. You know, you can live without a lot of these consumer goods. It's fine to make a profit off of that because people don't have to have that. But healthcare, I mean, you know, you're talking about, you know, you're talking about people's lives, talking about, you know, and the question for us, I guess, as a society is do we really want someone to be able to put like a, you know, a monetary statement on that, you know, as far as making a profit on people's lives and their health.
Maybe the industry shouldn't have profit.
Well, other countries, when they have national health care, there is no profit. It's provided by the government and by the people through their government. It's a collective endeavor.
Well, I don't mean to belabor the issue, but it is kind of important to get the perspective. But back to the idea of profit, with the doctor side of things, at what point do you think profit for doctors is excessive?
Well, I know that obviously medical school is very expensive. A lot of them owe a lot of money, so you got to be able to pay that off.
How much should a doctor be able to make? If you had to put a number on it.
maybe number that pops into my head is probably 100,000 a year.
100,000 a year.
I mean, that I'm trying to.
So if let me phrase the question another way. If a proposal that included a public option universal coverage included a cap on physician reimbursement, you could find a way you would support that perhaps, and then maybe if that number, you had to pick a number, that would be 100,000.
Again, I mean, I'd have to, you know.
Well, it's just your gut feel. You know, it's not.
My gut feel would be 100,000.
100,000.
You know, I mean, I think I'm not sure what the median income in this country is.
Well, that's what we're trying to get. We're trying to get people's perspectives. So if we capped it at 100,000, that would be okay.
I mean, they should make you know more than, I mean, because they provide this important service. You know, I mean, obviously, you know, you can make the argument that healthcare is kind of the bedrock of everything else. I mean, if you're not healthy, you're not going to be working or shopping or anything like that, or starting a business. So obviously, you know, they perform a very critical role. And I think, you know, it's within reason that they should be well compensated for that. But I was under the, I mean, you know, I was under the impression that the way the current, like say, Medicare and Medicaid works is that, you know, they're paid on a according to what the specific act that they do.
Right.
You know, they're reimbursed for that, so there is no cap on how much they can make total. I kind of presume that if you had like some sort of national health insurance plan would work, you'd have like specific price for a specific thing, which is that's what private insurers do as well. HMOs.
Any last statement you'd like to make? Things you think should be the most important feature of any health system changes, and why?
Encouraging people to be proactive as far as their health goes. Because if you have a system like you have now where people don't have health insurance and they wait until the last minute to go to the emergency room, and something, whatever's wrong with them, has gotten even worse than it would have been if they caught it earlier, that drives up the cost. So you got to have a system that encourages people to be proactive about going to their doctor for checkups and things like that. And that's where I think the public option would, you know, some sort of a public option would work by lowering the cost for, like, you know, proactive doctor visits, you know, because in the long run that will save money.
So if you had the choice, would you choose a public option for yourself?
Yeah, if it offered, you know, a better deal than what I've got now, and I really can't see how it could fail to do that.